Can we call the third speaker now? The third speaker is Dr. Mohamed Shawqi from Mansoura. Shokry. He will talk about stent graft for patients with lower extremity arterial aneurysms. Can it be the first choice? تفضل.
Bismillah ar-Rahman ar-Rahim. Thanks, Mr. Chairman. Thanks to the organizing committee. I would like today to speak about stent grafts for patients with lower extremity arterial aneurysm. Can it be the first choice? Peripheral arterial aneurysms are uncommon. Most of them occur in the lower extremities. Most of the available published data are limited to small case series and case reports. The evolution of endovascular techniques has improved the means available for management of these rare types of aneurysms. Stent grafts were originally developed for treatment of aneurysms and sealing of perforated and ruptured arteries. Peripheral arterial aneurysms are abnormal dilatation of the peripheral arteries due to weakening of the wall, which is usually caused by atherosclerosis, infection, trauma, connective tissue diseases, mainly basic disease, or post-stenotic abnormalities. The most common location for true peripheral arterial aneurysm is the popliteal artery, representing more than 70% of them, while the pseudo aneurysms are seen more frequently in the femoral artery. Patients with peripheral arterial aneurysm may present with a pulsatile mass, incidental finding, embolism with distal arterial occlusion, compression of local structures that may result in pain or edema, and rarely present with rupture. Treatment of peripheral arterial aneurysm. For many years, open surgery has been the gold standard for management of peripheral arterial aneurysm, but it was associated with many complications. With the advancement and development of endovascular technology, new endovascular techniques became involved in the management of peripheral arterial aneurysm with more safety. The application of stent graft in management of peripheral arterial aneurysm made a major step forward in their management as a day procedure done under local anesthesia with great safety. Our study was done in Mansoura University hospitals from May 2013 to January 2016. Follow-up continued up to December 2017. It was a prospective study included 24 patients with lower extremity peripheral true and pseudo aneurysm treated with stent grafts. All patients were assessed pre-operative by duplex ultrasound and CTA. We used two types of stent graft, fluency and wall graft. Patients received antiplatelets, anticoagulants, or both according to the etiology. In addition, patients with basic disease received immunosuppressive therapy to control the activity of the disease. These are some cases of our work. This is a case of superficial femoral artery aneurysm in patient with basic disease. After the application of stent, we have some leakage, so we do balloon dilatation for the proximal and distal end, and finally, there is complete exclusion of the aneurysm. Another case was common femoral artery aneurysm, and this is the CTA post-operative. Another case was superficial femoral artery aneurysm, also in a patient with basic disease. And this is a case with common femoral artery pseudoaneurysm in addict patient. This is the CTA pre and post-operative. Another case was common femoral artery pseudoaneurysm, also in addict patient. And this CTA was at 2 years follow-up. In our study, we have 14 patients with basic disease, which represents the main bulk in our study. 19 patients were with pseudoaneurysm, while 4 patients were with true aneurysm. The most common location was the common femoral artery and superficial femoral artery, with 10 cases for each location. We used fluent stent graft for 15 patients and wall graft in 9 patients. The access site was antegrade in 12 patients, and the other cases were, the axes were retrograde. Our technical success was 100%. Mean follow-up period was 23 months, and our primary patency rate was 67%, as shown in this Kaplan-Meier curve. As regard to complication, we faced complication as thrombose in 8 cases, access site pseudoaneurysm in 2 cases, stent fracture in 2 cases, and leakage in another 2 cases, and we have 1 recurrent case. This Kaplan-Meier curve shows the patency rate for each etiological type. It was the highest rate was with the addict patient, and the lowest rate of patency was with the atherosclerotic patients. The patency for the fluency stent graft was higher than that of wall graft. Since the first description of stent grafts in 1991 by Becker, stent grafts has been considered as a good alternative for management of peripheral arterial aneurysms. Due to the rarity of peripheral arterial aneurysm, it was difficult to gather a large number of patients during the period of our study, only 24 cases fulfilling our inclusion criteria. Basic disease constitutes the main cause in our study, about 58%, and the other cases were atherosclerotic, traumatic, or due to drug injection. In the most of the previous study dealing with covered stent in the peripheral arterial aneurysm, most of the patients were traumatic, mainly post-catheterization or atherosclerotic. Most of the previous study reported thrombosis of stent grafts mainly at location related to joints, and this occurred in our study, but in contrary, in our study, the highest rate of incidence occlusion was in the superficial femoral artery stent graft. We attribute it to patient non-compliance to adjuvant therapy. As in our study, most studies reported a higher rate of graft occlusion in atherosclerotic aneurysms. We noticed that stent graft occlusions is fairly well tolerated because grafts provide enough time for development of collateral circulation, so no cases of our study with thrombosis of the graft complaining from any symptoms of disabling ischemia. As regards adjuvant medical therapy, there is no guidelines for patients with peripheral stent graft, and there is no consensus on the duration of postoperative medical therapy. Some authors use the antiplatelet, others use anticoagulant, and some others use antiplatelets and anticoagulant. In addition, in patients with basic disease, immunosuppressive therapy are added to control the activity of disease and trial to decrease the rate of complication after the operation. Recurrent aneurysms after endovascular repair with stent grafts were reported by some authors in patients with basic disease, mainly at distal landing zone, and this occurred in one case in our study. We think that it may be related to disease activity or stent migration. Our conclusion: our results were almost not statistically significant due to small sample size due to the rarity of the cases, but the early results were encouraging. Endovascular treatment with stent grafts is a low risk and less invasive procedure, so we can use stent grafts as a first choice treatment option for suitable aneurysm, especially in traumatic and vasculitic patients, to avoid manipulation of these variable vessels and avoid suture line pseudoaneurysm. However, stent grafts in atherosclerotic peripheral aneurysm still remain questionable. Thank you.